Hi guys, welcome back to my channel. So today's video is very different from anything I have ever filmed before, and I'm doing this after a lot of thought and some discussion with family and friends. I'm basically doing this as informative. I know a lot of my viewers are women, and I think we're all in a similar age range, and so I thought that a video like this would be important in case if you're going through a similar situation and you need some information, or if you were just told that this is something that you need to get done and you're looking for information, or if you haven't considered, getting this done, and hopefully this will remind you to do it and remind you how important it is. So today's video, as you can tell by the title, is about my experience after having a mammogram and ultrasound. So if you saw my community post, I don't think those get circulated around a lot, but I did have surgery on March 5th. That was Friday. And I'll talk a little bit about what happened and why. And I'm going to try to keep this a little bit short. I know I can kind of go on and on, so I'm going to try to do my best to keep it short, but I'll start at the beginning. So in 2017, in doing a self-exam, I noticed that there was an area on my right side, on my right breast, that just didn't feel normal. So I'm in my 40s, I'm in my mid 40s, and at this time I think I had just turned 40, or I was 41, something like that. But I had noticed that there was an area that was bothering me, and there were times where I would feel kind of like a shooting pain in there, or just like some discomfort, and I didn't know if it was because of my bra or if it was because of how I slept, or maybe I hurt myself, I didn't realize it, but that feeling would come and go. So when I went in and saw my doctor for just like a general checkup, I mentioned it, and he also did an exam and then said, let's go ahead and get a mammogram and ultrasound. I don't have any family history for any kind of breast issues at all. So there's nothing. If from my mom's side, my dad's side, cousins, extended family, there really isn't any family history of anything. So I wasn't that concerned about it. So I went in towards the end of 2017 and I did a mammogram, which came back kind of weird. There were some things that were visible on the mammogram, and it was a 3D mammogram. So that same day, while I was still there, they followed it up with an ultrasound, and just to confirm some of the areas on both sides, and said that they were probably benign and that I need to come back in 6 months to do a follow-up just to see if there were any changes or anything new and that sort of thing. So that would have been that my follow-up should have been 2018. I didn't go. I pushed it to the back of my mind. I didn't think much of it at all. Other things were going on in my life, and I'm busy. I was working full-time. I have kids and, mom life, work life, stuff like that. I really didn't think about it. I knew in the back of my mind that I needed to go, but I didn't schedule the appointment. Okay, so I needed to get back in there in 2018. That probably should have gone back the spring of 2018 would have been ideal. But like I said, I didn't end up going. Not only did I not end up going, I didn't go until this year. So it's about 2 years overdue for my follow-up mammogram and ultrasound, that sort of thing. So I went in to see my doctor for other things, and he looked at my file and said, you never got your follow-up, and was really aggravated by it and everything. And I said, oh, yeah, I just kind of forgot about it. I don't know. I didn't think about it. Nothing feels abnormal to me. I feel fine. And he said, it doesn't matter. You still need to go in and you need to do a follow-up mammogram and ultrasound. So I scheduled that, and I wrote down when I went in. I ended up going in for that on January 21st was when I went in for the mammogram and ultrasound. So I went in there, and the whole thing takes about 3 hours when you do the mammogram, and then you follow it up with the ultrasound. Then you meet with the radiologist after. at least at my hospital. The radiologist comes out and talks with you about the test results, and had said that there are definitely some changes and that there were calcifications that were seen. Basically that the same area was still there, but now that there were calcifications, which are little tiny things you can see in the imaging. I don't know what causes calcifications or what they are. I'm not a doctor, but ask your doctor if you're concerned, or about anything I say. Talk to your doctor about it, obviously. I'm just trying to explain my experience. So there were some calcifications that were found, and they could be seen on the ultrasound and the mammogram. So what they recommended at that point was something called a needle core biopsy, which totally freaked me out. I was already nervous about getting the mammogram because I knew that I had delayed in doing the follow-up, and then at the same time to be told that I now needed a biopsy, it was a really bad time. Like, I kept thinking, what did I do to myself? Why wasn't I paying more attention to my health? Why, basically? Why did I do this, So I went in for my needle core biopsy on the 28th. And what that is pretty much what it sounds like. They numb you, they look with anesthesia. They just, not like oral anesthesia, but they just numb the area. They give you a shot, they numb it, then they go in and they extract a few parts, some of the tissue, in order to take it out and biopsy that and see what it is that they're seeing in the imagery. So I did that. It was uncomfortable. That took me, I think I was at the hospital for about 3 hours, but I drove myself there and I came back home. So I was fine. I was numb for a couple days. I was numb for that day, and then I think I just followed up with Tylenol and I felt fine. After 1 or 2 days, it was okay. It was not a big deal. The only thing was the stress I was putting on myself, because here I am waiting for this biopsy report to come back. So I was kind of an emotional mess at that time, and I drove everybody around me crazy. And I'm trying not to get emotional right now, but I drove everyone nuts. I think because here I am waiting for this biopsy, what's going to happen? Why did I do this? Why did I wait for so long? So I'm doing this mainly so that you don't wait. If you need to go in and get something done, or if you notice something on your body, or if you're over the age of 40, or if you have a family history, put yourself first and go and make sure that you get checked. So here I am waiting for this biopsy report to come out, and at the hospital that I go to, I'm signed up to where I receive reports and updates and things that happen in my file. So I received the biopsy report before getting a call from my doctor, and I probably shouldn't have opened it, but I'm an anxious person, so I had to open it. And what was recommended was to have the area removed completely, and that also be sent to pathology. So they were recommending surgery and removal of the surrounding tissue, including all the calcifications, everything, and to just take them out, because they didn't know if they were good, if they were bad, or if they could turn into something worse later. And I think it's called atypical hyperplasia. And it just basically means, from what was explained to me, and again, I'm not a doctor, is that those are cells that are not normal, that are, I guess, damaged in some way. And so they just need to be taken out, because it could turn into something later. Could, not 100% guarantee. It could, as you get older, turn into something else later. So that was kind of heavy, and I was waiting, I think it was 3 weeks. So I got the biopsy on the 28th, and my surgery was on January 28th, and my surgery was scheduled March 5th. So I had about a month, the entire month of February, where it was pretty much all I could think about. I tried to keep myself busy. You guys saw I posted a few YouTube videos and stuff, but I just wasn't myself, because I knew that this was coming up, and I wasn't sure what the results were going to be or what the experience was going to be like. And I was worried about having surgery and going under general anesthesia. I have had surgeries before, but they were C-sections. I've had 3 C-sections. 3 of my 4 pregnancies were C-sections, but those are different because there's a baby and you're excited to see the baby. So this one, it was a different kind of processing for me, I guess. So I went in on the 5th. Before that, I had met with my surgeon and I just loved her right away. She had great information and I trusted her immediately. She was one of the best in the area and she came off as super confident and full of information for me. Told me not to worry, that the procedure is relatively easy, and that basically to just trust her. And I chose to trust her. So I went in on the 5th. My husband took me to the hospital and waited a little while until it was my turn. But before that, we needed to do something called and I wrote it down, it's called a local wire mammogram. So when they did the needle core biopsy, they put a little tiny metal clip in the area so that for future mammograms, they can always pinpoint the exact area and see if there are any changes there. So with the needle core biopsy, it's basically the same thing, except they insert a wire in directing the surgeon to the exact location of where that clip is and where the area is, so that she can make sure to check around and take out whatever bad tissue there is. And I'm so sorry if I'm grossing you out by use of those words. So I had to do that first. That was under local numbing. So it wasn't a big deal. It just took a long time. And again, it's mammogram 3D, so mammograms are not comfortable, but I had to go through that. And after that, they took me out to wait for going into the operating room, basically. So when it was my turn, they took me in. I fell asleep. They put me under general anesthesia. Don't remember anything about the surgery at all. Don't remember, thankfully, don't remember it. And I woke up, I was already in the room, the room I was in before. The surgeon came in. She told me that she didn't see anything concerning when she went in there, but she was able to clear out all the calcifications and all the areas that needed to be taken care of on that side. That the pathology report might take about a week, but she will call me and I have a follow-up appointment next week with her. So I don't know what the results are yet of that, but I think the whole point of this is, what I want to tell you is just make sure to take care of yourself. I know that there is Breast Awareness Month, and yesterday was Woman Empowerment Day, and I think it's just so important as women to really pay attention to your body. If you are feeling something odd, if a doctor tells you to do something in order to take care of yourself, like do a follow-up test, get that follow-up test done. Don't wait. Even if it makes you anxious or scared, it's better to get it done and find out what things are so that you can move on and you can get whatever treatment you may need. And you might not need treatment at all. It might have not been anything, but it's always good to check. Make sure that you check on yourself. And I was having a conversation with one of my really good friends on the phone, and she said, you know, stress manifests in different ways in your body. And I think it's so true that when you carry on a lot of stress through whatever situation you might be going through or might be experiencing or have experienced, it's going to come out in some shape or form, either on your body or through your actions. So I really think like paying attention to that and trying to take care of your emotional health is so important. You know, try to take care of your emotional health. I've been trying to do that lately, especially after February, which was incredibly difficult for me. I just feel this after having the surgery, knowing that that area was removed, I have like this complete sense of relief. The weekend, I pretty much was sleeping off and on, and I think it was not just because of the surgery, but because I felt such a relief that it was over. I didn't realize how much of a burden I was carrying at that time. I'm sorry, just trying not to get emotional, but you know, and it's really made me think about how much stress I carry inside, and how little I pay attention to myself, whether it's eating the right food or making sure that I'm getting enough sleep, and really just taking inventory on a regular basis of what my needs are. And I think that's so important as women. So please, if you are of the age of when you need to start taking mammograms or getting mammograms, or if you have a family history and you need to get them done earlier, and if you are told to get a follow-up, go get that follow-up. It's not that bad. I went through the experience. It was a lot bigger in my head than what it ended up being, both for the biopsy and then the surgery that I had. I feel fine. I've only had to take Tylenol. I've had little pain, other than just some soreness, and you know, every once in a while it bothers me, but overall I'm okay. And I hope to start putting out videos. I should have another video out this week. I just really wanted to share this with you, and kind of like a announcement that, not an announcement, what would it be? Public service announcement, to just make sure that you pay attention to your body and get that mammogram. If you need the ultrasound, get the ultrasound. If you need the follow-up, get the follow-up. If they want you to do a biopsy, get the biopsy. Don't run away from it. Get it done. Do exactly what the doctor suggests, and do self-exams. I really, really recommend that. I think it's very important. You need to know your body. Do it at least once a month and find out, you know, pay attention, so that if there are changes, you can call your doctor and you can get things looked at right away, because early detection is key, and it's just so important. And as women, we have so much we have to worry about for our bodies. We do. There's just so much that we have to take care of, and you know, pay attention, basically, I would say. And I wish I paid attention. I wish I went and did my 6-month follow-up when it was recommended, because maybe I wouldn't be in the situation that I'm in today. So the pathology results haven't come back. Like I said, I won't get them back probably until later on in this week. If you want to know what those are, I'd be happy to share them and explain what the next step is. Hopefully there is no next step and everything comes back okay, and I can just put this whole thing behind me. If there is anything that comes back in the report that requires me to do another follow-up, then I can let you know, just so if you want to follow the process, and if you're curious, and or if you or somebody you know is going through the same situation, that way we can kind of go through it together. So anyway, I hope this video was helpful and informative. It's kind of a life update video, but at the same time, I really want to help, and I want you guys, I really want you ladies to pay attention and take care of yourselves and do the best that you can for yourself. But other than that, right now I'm feeling pretty good. I'm relieved that it's over, and now I'm just waiting for the results. So I'm just leaving that to God, and hopefully everything comes back okay, and whatever it is, I will just do what needs to get done. So feel free to leave any questions for me in the comments below. I'm happy to answer whatever I can. If you have gone through something similar and you feel comfortable sharing it, you can also share that in the comments. That way other women can get some more information if they happen to come across this video. And I guess that's all for now. So love you guys, and I will keep you updated as to what happens. I will be putting out another regular video this week, now that I'm feeling a little bit better and I have a little more energy. Keep an eye out for that one. That should be coming up soon. And I'll see you guys in my next video. Love you all so much. Bye.